and I got 11 on it. So it's very well done, I guess. Just try to show more IBS. Like for me, for example, just to collect some data in IBS. So I told him, what is it? I like contraindication, yeah. So even I don't know what contraindication for perispeculum or not. Just I told him it's really important to check for any contraindication before starting any procedures, because those patients come to us to help them. So it will be really bad if we cause more harm to them, and we didn't be like cautious about this. So this kind of thing I was trying to show off, but. And being very nice to him, and are you following me, and embrace him for everything he did or he didn't do. Yeah, but anyway, you did it very well done, and it's very clearly structured, and I was easily following you. Even I was saying okay too much. So but still you need to ask me if you want me to explain it more or not.
Okay.
Yeah, but very well done. Excellent.
Thank you.
Very good, and very good tone, and I enjoyed you teaching me, so it's really very good.
All right. Okay. Thank you so much.
You're welcome. Asma, any comment?
I'm fine. So in case of teaching station, do we need to like explain any kind of cervical, like what is the purpose of doing this cervical screening test, and also what we are going to ask to the patient regarding the history, or just we will teach the procedure only?
So teaching stations, there is no right or wrong approach, because they genuinely examine your teaching skills rather than the information inside. So because if you teach in perispeculum, anyone can teach it in his own way. Like you can explain the reason about it, or you cannot explain. You can just focus on the procedure itself, forget about anything. But whatever, everything, just you say it. It doesn't matter what you say or what you explain, but just you have to explain. Like if you said any sentence, you have to make sure it is clear to this student, and you have to explain it if it's not clear for him. And as I said, you have to be organized in your teaching and have a section, move from section to section in a clear way, so someone can follow you easily. But what you say inside is not really necessary, because in my station, I got 11, but I missed million of information according to script. Like it might sound very important, but I missed it. But I had my structure, I had my communication skills inside. I have my general approach. Even perispeculum, it fell in the floor from me. I couldn't do it right, and I apologize for the student. I was very shaky, but still I was laughing, shaky inside, but laughing from outside. So try to just show that you're really kind, you have teaching skills, you speak in clear voice, checking understanding again and again, and having your structures and explain things, and try to show some good communication skills, praise the students, show that you are safe to the patient, show that you're very caring to the patient. Just try to make any sentences that show that you're really good. They will give you very high marks. So if you read just some few academies, different scripts, you will find different points here and there. But I would always say even academy are not perfect. So always follow yourself and just try to show off you are really very good. They will give you very high marks. You wouldn't expect it. Yeah. So there should be explanation in all teaching stations. There should be explanation. So for this one, you could explain the reason behind it. You could explain, for example, indication, contraindications. You could add anything. Will make the teaching even more enjoyable, because you are not just explaining the procedure. You can explain more other information about it. That's absolutely fine, but say it in a nice way. Yeah. But if you missed it, it wouldn't mean they were going to drop your marks because you missed explanation, for example. He wants to learn about the procedure and he's starting from scratch. Anything in 8 minutes will be fine, but it has to be teaching, like proper teaching. Here they have guidelines for teaching. It shouldn't be like as it comes, it goes. It has to be organized. It has to have introduction. It has to have conclusion. It has to have sections. It has to be explained in simple way. You have to take understanding. You have to make sure the other person is following you. So this kind of things. And you have to show that you enjoy teaching. So don't teach while you distress, like you'll have to do all of it. Like when you go from one stations and going to the other station, you will have the stress of previous station. And this is really affecting many people because it's really, it will affect your tone. It will, even your memory can be affected with your stress. So like whenever, how much, no matter how bad you did in the previous station, you have to forget all about it. You have a chance to fail 6 stations, and no any station you would say I would fail it, you're going to fail it, because they will take lots of things throughout the stations. And if you followed being organized in your history and good in your communication skills, they will never give you less than 6, even if you don't know what the station about. So be safe, doctor, and you didn't bring anything from your head or from script, so they will not fail you. So you have the base anyway. From now you have the base to pass the exam, so you don't need to get distressed. Even if you said, and never, like the major mistake people say, they will compare what they said according to the script. Who tell you this script is perfect? Like I know many people who learn the script by heart and all failed. Everyone insists to follow script, they fail because examiners know the script. And even when you follow the script, they can make a little bit of changes inside the station to check who is scripted or not, and you still follow the script, so you will fail. So don't compare what you did to what you learned before the exam. There is different things you will be surprised with them inside the exam. There will be some new concern. As far as you ask, if you didn't ask and you assume the station, this station, the same one I know, and you just ask your checklist and get out of the station, you will think I didn't cover this and this and this, because you're comparing to the script station, which is totally not it. So just go to the exam as just, now you will develop skills. But when you go to the exam, you will be yourself, you will follow the patient, you will keep your structures, you will intentionally put your IBS sentences here and there and show that you're good communicator, because this is major area in PLAB 2, and you will show that you are safe doctors. You will have history of present illness, past medical history, personal history, examination, investigation, management in the same order, and management easy. Explain the conditions, symptomatic treatment. If you don't know, senior review, and then follow up, general advice, safety netting. Even safety netting has failed, you don't need to think about it. Just if you develop any new symptoms or you didn't improve, please come back to us. It could be just general statement, but still you having the major, because in PLAB 2 they have major points they will tick you. For example, safety netting like this, it's not stated for the examiner what exactly question they need to ask in this safety netting. It just, you are safe doctors, you have always your safety netting. Just if you tell the patient, if you develop any symptoms or you have not improved within the next 2 days, for example, please contact me as soon as possible. Even if it's totally not related to the station or whatever, it sounds awkward to the examiner, but still you show that you are safe, they will give you the mark for safety. He will tick you because you just ensure safety netting. It shouldn't be like if you have convulsion or fever, come back to us. It shouldn't be like this. So just the most, and for example, if you spend too much time explaining one point, for example, if the patient asks you what heart failure and try to explain the pathophysiology and everything about heart failure, you wasted 1 minute here, or you wasted 1 minute in taking detailed sexual history. It's tiny mark just for sexual history, they will do the tick. They don't concern too much about the details, so you're wasting your time. So always try to make sure you cover the major area in PLAB 2, what they're expecting from you. Show that you have good, they have some tick for listening skills. Show that you have good listening. So always summarize. When you summarize back, it shows that you have good listening skills. When you explain the condition of the patient according to their symptoms, tell them, for example, Heart failure, for example, it's due to, for example, your heart is not working properly and it causes symptoms which you having like difficulty breathing, for example, just an example. So you also show that you have good listening skills because you connected what the condition to the patient's symptoms. So this kind of things you will show and always signpost to be nice, to be kind, even like they see that if you involve the patient from the communication skills, it shouldn't be one-way station. It has to be like if you kept talking and the patient not saying anything, they will drop you down because you are not engaging the patient. So make sure throughout, we have 2 stations, all of them are throughout the stations, you get the patient involved. Explain to them why I'm asking these questions. And also ask them permission. Is it okay to examine you? Is it okay to have this painkiller? Don't be happy that I'm describing you painkiller because you are in pain. Who told you he wants painkiller? So you need, is it okay? So I'm going to prescribe you some medication or some painkiller for your pain. Would that be okay by you? So don't assume the patient is happy with taking everything. In this country, no. It's always, we have to check if it's okay by them or not. We take permission for everything. So this is the things they will be listening skills. You are not interrupting the patient. You are acknowledging their feelings. You are organized. You are safe doctors. So this is the major things they will be looking for. So you don't need this. When you practice, always make sure you're having these things.
All right. So just a rundown again of the topics that usually come for teaching. You said testicular examination,
ECG,
ECG,
perispeciculum, and EpiPen, epinephrine pen, and
epi.
yeah. So epinephrine pen. So they have pen to give epinephrine in terms of you have anaphylaxis at home.
All right. Okay, yeah. That pen.
Yeah, pen. Yeah.
Okay.
And heparin injection.
Which injection?
Heparin.
Heparin. Okay.
Yeah, and also abdominal examination.
Abdominal examination.
They have abdomen mannequin, so they need to make use of it. Sometimes they brought it for UTI, for polycystic ovary syndrome. And they brought it for UTI for abdominal examination teaching. They have mannequin for abdomen without hand and legs, just abdomen. They put it for you.
Okay.
All right.
So sorry, just for ECG, is it mainly just teaching how to set it up?
So the patient tell you, I don't know anything about ECG. He wants you to teach him from scratch. So the time will be just enough to teach the rate, rhythm, and like you will introduce him to the ECG part, like just teach him about the waves and segments and rate, rhythm, and the station will finish.
All right.
But you can add some example, give him some example. And because you still in the teaching station, they will take you for management. So you need to include example and the treatment for it.
Okay.
Yeah.
That's fine.
And we have testicular examination, yeah.
Okay.
All right. Any question?
No.
Okay, so I think we will finish here. But yes, Asma, do you want to ask anything?
No, next time, please give me ethics and breaking bad news. Also, the stations which involve like IPS, more IPS.
Yeah, but even like history based. In fact, in the essay, you can remember to do the IBS part. But if it's history based, you because I know like you have good medical knowledge, so you'll be focusing on your medical knowledge and you will forget all about IBS. So we need if it is history based or ethical station, we need to include same communication skills inside. It has to be exactly the same regardless. Even in Simman, because the mark is still 4 in all the station regardless, even in Simman, we need to show that have good IBS. Even if he's unconscious, we will talk to him, we will take permissions, we will reassure him, please don't worry, we are here for you. So you need to get used to it in all kind of stations. And yes, no problem, next time we can give you more challenging station like counseling or this kind of station. No problem, inshallah. Okay, so I also will try to prepare some more few sentences for you just to ease your life here, because still I need you to advance this area. No problem. Best of luck. Yeah.
Thank you for today.
You're welcome. See you tomorrow, inshallah.
Okay, so the class is tomorrow again at 6.
Yes. If you are free, so I hope everyone will be there.